A new report from the Centers for Disease Control shows a disturbing trend. The rate of suicide among females ages 10 to 24 is on the rise. Here to break this down for us is Dr. Shruti Mutalik, a psychiatrist in New York City. What do you think could be leading to this?
So it's not very clear from the report what could be leading to this, but what is clear is that the methods of completed suicide are changing. So the CDC looked at data spanning about 2 decades, from 1994 to 2012, and what they found was that there's a rising trend of completed suicides among young females by methods of suffocation such as hanging.
Why does the method matter?
So if a person tries to hurt himself or herself, whatever method, it is very important that we help the person, that we intervene. However, there are certain methods that have higher lethality than others. For instance, if a person takes some pills in order to end his or her life, then the pills have to pass through the stomach, sometimes the intestine, before they're absorbed into the bloodstream, and there may be a relatively wide window of time and opportunity to intervene before the person can suffer widespread damage and we can save the person's life. However, if a person tries to shoot themselves or jumps off a building or uses a method of suffocation such as hanging, then unfortunately we may have a much smaller window of time and opportunity to intervene.
We're talking about healthcare interventions, but what about for people at home if they notice a friend or a colleague or a coworker who might be contemplating suicide?
So if someone's contemplating suicide, or if we're concerned that they're going to do something imminently to hurt themselves, that is an emergency, and we cannot leave the person alone. We cannot leave the person around dangerous objects or firearms or drugs or alcohol. It's very important to call 911 and or escort them to the nearest emergency room.
How about warning signs even earlier than that?
So the warning signs are twofold. There are concerning statements, such as if a person starts talking about killing themselves or about feeling hopeless, helpless, worthless, feeling like a burden, feeling like they're in unbearable pain. And then there are concerning behaviors. So if a person starts giving away material possessions, or if they start withdrawing or isolating themselves, or if they seem very anxious, very restless, or seem to have very unusual mood swings.
What can you do in that case?
So it's very important to not ignore warning signs. It's important to check in with the person, see how they're doing. It's important to also remember that asking a person about thoughts of wanting to hurt themselves does not put suicidal thoughts into their head. So do not ignore such warning signs. And if you're unsure about what to do, if you don't feel comfortable approaching them, then it's very important to be aware of something like the National Suicide Helpline. They educate you about local resources and things you can do in your specific situation.
Now that number is 1-800-273-TALK. So on a larger level, when we talk about suicide, there's a risk of talking about it too much to the point where it glamorizes it and leads to more suicides or suicidal clusters. But if you don't talk about it enough, then you miss an opportunity for public awareness. What are your thoughts on that?
So yes, it's extremely important that we spread awareness about suicide prevention. Suicide is an extremely big public health concern. But it is also important that we do this in a thoughtful, sensitive, responsible manner. So for instance, media professionals have guidelines about how they can report a suicide, both in terms of the language they use, in terms of graphic content. And as far as lay people are concerned, when we're using social media, for instance, we have to be thoughtful about how we talk about suicide, how we talk about grieving families and what impact our statements might have on them. And of course, if there are inappropriate comments, it's very important to address them, to flag them or take them down if they are romanticizing suicide.
And of course, we should keep an eye out for posts that suggest someone might be thinking about suicide.
Yes, absolutely.
All right, great insights. Thanks so much for joining us, Dr. Mutalik.
Thank you so much for having me.